So hello everyone, and thank you for attending to this session. I have been asked to speak about the role of international health organizations in the communication of COVID, and I will cover briefly these two objectives. One is to review the response of selected international health organizations to the needs and challenges of communication during the first months of the COVID pandemic, and also to identify some lessons learned, preliminary lessons learned, and propose areas for improvement for the coming months. We need to keep in mind that the pandemic, the COVID-19 pandemic, is an evolving phenomenon with varying trends. So depending on the countries and depending in time and place, we see different trends from increases to decreases to, as we are seeing currently in the recent months, again, new surges and new increases in the number of cases. And of course, I'm saying this because this is relevant to understand also the trends in the communication, in the related communication. As a pandemic, it was an epidemic, we can establish different phases of the response: the pre-crisis phase, the crisis, the post-crisis, and then the recovery. And that has implications for the three key public health management components, which include risk assessment, risk management, and risk communication. And these three components, of course, are interrelated. So basically what we're seeing is that we need to keep in mind first that we may be in different phases of the pandemic, and this is a little bit more complex than just the conceptual model that is outlined here. And at the same time, risk communication, the component that we'll be talking about, is somehow closely entangled with the other two management components: risk assessment and risk management. And there's been, of course, a lot done in terms of preparedness and the crisis and emergency communication response. This is just a summary from the CDC, the US CDC, talking about the different phases regarding communication of crises and epidemics, including the preparation, the initial response, the maintenance, and the resolution, each of them with focusing on different aspects, which I won't cover. And of course, that also includes engaging the community, empowering decision-making processes, and also evaluating the deployment of the communication strategy and action. But we are in a context that has some specificities. One is complexity and uncertainty of the evidence, largely the scientific evidence. But also of the effectiveness of the measures that are being implemented at each time and place. We also have to keep in mind that this can be tagged as the first pandemic live stream. So things happen, and when things happen, almost they are shared throughout the world online and in real time. And third, and very important, we are seeing this phenomenon of infodemic, of mis or disinformation, and also rumors, largely through the social media. And I'm just sharing this quote from Laurie Garrett in a recent Lancet article, stating that the current global COVID-19 epidemic features mechanisms of delivery of scientific information, so that includes communication, that are frankly unprecedented, adding to pressure for proper interpretation by the media and the public. So basically, on the one hand, we have a scheme that have different schemes that have been tested previously in other public health crises, but at the same time, regarding communication, but at the same time, we're in a context of some specificities regarding the current pandemic and the current crisis. So what is the role regarding communication of some of the key stakeholders in global health? And I will focus, as I was asked, on multilateral and international organizations. So that includes WHO, the European Union, and namely its Center for Disease Control, but also other multilaterals like Gavi, Near of Vaccines, like the Global Fund for HTB and HIV, the World Bank, etc. And of course, they are also connected because it's part of their governance with the governance. So this is a little bit on the key stakeholders, which I will be focusing on regarding communication. And of course, we're talking communication aiming at individuals largely, either healthy individuals or sick individuals and their families and communities. We can share, I'd like to share some basic information on aspects regarding trust and COVID communication, for example, and this comes from a recent survey performed in March in different countries from different continents. You have it in the bottom left of the slide, where we see that almost 3/4 of people worry that there is a lot of fake news and false information being spread. Almost half of them express difficulties to find reliable and trustworthy information about the virus and its effects. And most of them privilege scientists regarding this type of information over politicians. And looking at, in the same survey, what are the sources that people look at to get the information, we see the major news organizations, but this is followed by national government sources, social media, and global health organizations like the World Health Organization. So the two that with red arrows are the ones that I'll be covering here. And as you see, they rank very much reasonably high in the rank of the relied sources of information with some variability depending on the countries. For the case of Spain, by the way, close to where some of us work, beyond scientists, doctors, and other health experts, again, the World Health Organizations and national regional health organizations rank among the considered most reliable sources around the COVID pandemic. So looking at precisely what these international health organizations, how are they facing the communication response, let's start with WHO. WHO is covering, of course, epidemiological data, including dashboard data to follow on the trends in different countries and regions. A second area of work and communication is the advice for the public and for health workers, where differently from other previous crises, there are some specific areas of information regarding infodemics. So for example, a section on mythbusters, a section on how to report misinformation, and other complementary aspects for the public and for health workers. And of course, given the nature of this organization, a lot of information has to do with country and technical guidance, including risk communication, for example, on healthcare facilities, on long-term care, non-acute care and home care, and on community engagement and other areas. So this is a little bit a summary of what WHO has been covering with, of course, evolving contents. And specifically for the European region of WHO, I just wanted to point out two additional aspects. One is a specific chat to respond to people's consultations, individual consultation, and then also specifically on the area of patient experience, a couple of documents, so that's really not a lot, but a couple of documents summarizing on the one hand, palliative care during the COVID pandemic, some experiences from Spain, and from Portugal, also some experience around diabetes care during the COVID pandemic. If we move to the European Union in terms of the COVID communication has really focused its efforts through its European Center for Disease Control, ECDC, which if you look at the web page, has three main areas of communication: risk assessments, guidance and technical reports, and then other infographics, posters, and videos for different audiences. And this is in response a little bit to a pre-established preparedness model where communication, of course, is one of its main components. For the European Union at large, the communication around COVID has been a little bit referring to aspects of the responses in different governance bodies. So not only health and action areas, but I wanted to highlight a specific section regarding fighting disinformation, which a little bit parallels the efforts that are being done at WHO regarding the challenges of infodemics. And finally, the third group of international health organizations would include other UN system organizations like UNICEF or like UNDP, but also the Global Fund, Gavi, World Bank, and so on. I won't go in depth into that. Basically, they have been providing institutional and technical information regarding their areas of their mission and their areas of work, and also some specific information regarding responses, funding, data, and some news. But these are pages that are more institutional and less oriented towards the public, either patients or citizens at large. What summary can we have of this? On the one hand, we are talking a challenge and a risky business, as reported by the paper quoted here. And among others, because international health organizations rank high in people's trust as a source of information, as we saw, but at the same time, the lack of proximity to the populations and to other groups in the society poses some additional challenges. And these challenges have been faced with formidable response efforts within a short period of time, and of course they are evolving. There's a great diversity of information, of course, evolving with the scientific knowledge and the experiences of different countries and regions. But I just wanted to point out that some groups like patients or like young populations probably are not among the most represented contents, at least until now. And there's been also a limited communication strategy with other actors and platforms. And I will go back to that because that's one of the issues or one of the challenges for the future, the connection between these organizations and social media. Little recognition of the emergency risk communication social networks, which is a phenomenon that is also emerging, for example, in Japan. And the increase in the needs and expectations doesn't seem to be parallel by the increase in resources to support communications, at least in some of these institutions. The second thing is what has been the response, and especially for WHO. WHO privileged social media communication initially in the initial stages of the response over more formal and the international health regulations communications tools. So a little bit, the initial communication departed from what was in the protocols, and several communication media were used in a certain way, generating some misunderstandings and some ambiguity regarding the contents. So somehow the initial protocols didn't seem to follow very closely what was defined as the preparedness and response procedures. But on the other hand, a lot of efforts have been devoted to fight disinformation and rumors. And for the case of Europe, Europe is being a little bit an interplay of these distinct national measures without concerted action, without a clear concerted action, with some variations in this appraisal, and that includes communication. So basically, beyond ECDC, there is not much of an aligned communication response. Basically, this response has been focusing on epidemiological and technical information. So what are some of the challenges and proposed actions? And I'm closing with this. I believe that international health organizations need to strengthen their communication strategies actions and resources in a context of risk uncertainty and confusion over trust and legitimacy of the many information sources available, and also taking into account the limited health literacy of large parts of the population, and especially the most vulnerable populations. And special efforts could be upscaled by this organization in specific areas and tools. For example, health systems from the patient experience, there's little that we can find. Public health from the citizens' experience, adolescents and young adults, I mentioned previously, and also including communication as regards more its role regarding the use of digital health tools that are used for a public health response. And two other aspects deal with partnering efforts and accountability schemes. Regarding the partnering efforts, let me share with you these thoughts that are based on different papers, but basically all members of digital social networks, which includes these government agencies, share the responsibility to help address the broader implications, in this case, the communication implications of the pandemic. There's been actions taken by government agencies to partner with the social media giants, so Facebook, Twitter, and Instagram, and they show how this cooperation can help flag, fact check, and even remove false or outdated information, and this can be effective to somehow strengthen the public health efforts. At the same time, some social media companies are committing themselves to regulate content in the light of the pandemic, and this can boost the efforts by public health authorities, for example, of ranking links to recommendations from recognized health authorities or recognized sources, and down-ranking ads, for example, for essential limited medical supply, like face masks or similar products. And finally, there are opportunities for partnerships between public health agencies and the creators of consumer and entertainment news videos, which may be an effective strategy to broaden the reach and impact. On our side, from the Barcelona Institute for Global Health, we recently published, together with my colleague Jeffrey Lazarus and other authors, what we call a COVID assessment scoreboard, a scorecard, from the perspective of the health systems building blocks from WHO. And one of them precisely has to do with the relationship between leadership and governance and the role of the people, so representatives from affected groups and public health experts as a way of, as a key area, which needs therefore some periodic assessments. And I won't go through that because the slide cannot be read, but that includes this assessment scorecard, or the COVID score, includes some questions regarding precisely the contents and the characteristics of the information between the governance, between governments and international organizations can be included here also, and the public, including patients. So to conclude, health as a global public good requires adequate and harmonized preparedness measures where communication plays a central role. International health organizations, like we've seen, need to expand their communication capabilities, both deeper and wider, and ensuring, of course, the adequate funding to support that, and a more intensive use of novel models and tools which are very quickly emerging and evolving. And also there's a need for a greater effective cooperation between international health organizations and other key stakeholders, especially with social media platforms and networks. And finally, we need to include in the accountability assessments the role of communications and communications procedures to ensure that this is well developed and a significant contributor to the COVID response. So with this, thank you for your attention, and I hope to be able to answer your questions in due time. Thank you very much.